Hi, everyone. Good afternoon. I'm really excited and a little bit sad to be kicking off the final panel of the final RISE conference and coming to the end of what's been a really fantastic 2 days of learning and also really fantastic time personally for me to get to spend time with all of you. We concluded yesterday with a look forward at what is coming after RISE, and we're ending today with a look back at the consequences of the COVID-19 school closures. But as I was reading these papers and reflecting, I was really thinking about what important messages the lessons that we can learn from these papers have for preparation for future disasters and crises. In the early days of the pandemic, we looked back at examples from natural disasters to understand what the effects of school closures might be. Jishnu, Tahir, and Daniel's paper from the earthquake in Pakistan, which RISE put out, ended up being a really important one that was referenced widely. And now looking back at the lessons from COVID, things are going in the other direction. What does that experience have from the pandemic to teach us about how to think about resilience, response, and preparation for the future? I couldn't help but be thinking about children in Morocco and Libya as I was reading these papers and what's in store for them as those countries recover from the disasters that happened just in the last couple of weeks. So in this panel, we have 3 papers about how the return to school process worked, and what the effects were on different subgroups of children. Carolina Better is going to start us off, we're going to start off actually with a paper from Ashutosh Bhuradia from India about household choices around expenditures in education and return to school in India. Then we're going to go to Andreas Backhaus with a cross-country analysis from 6 countries in East and West Africa on patterns for girls' return to school, and also on the types of fertility and labor market decisions that girls were making and events in their lives that shaped their return. And then finally, we're going to turn to Carolina Better, who's going to speak to us about an experiment conducted by Ideas 42 and Uwezo Uganda about what kinds of encouragement messages can help nudge parents to reinvest in sending their children back to school after the pandemic. So with that, I'm going to turn it over to Ashutosh to get us started.
Thanks, Marla. All right, let me see if I can make this work. Oh, I can. Okay, great. Hi, my name is Ashutosh Bhuradia. I'm a PhD student at Harvard, and I'm thankfully not on the job market. I'm presenting a paper which was done in collaboration with Emmerich Davies right there, and Yuan, who couldn't make it. So I'm going to start. So as we all know, the COVID-19 pandemic had a severe impact on education systems around the world. In particular, COVID-19 had resulted in school closures around the world, and there was a great deal of variation in terms of school closures. So as you can see, this is a plot of the number of days schools were closed, and these dots are like countries. And India is right there in the corner. So India had the 4th largest or 4th longest school closure compared to other countries in the world. And as a result, schools in India also opened much later than elsewhere in the world. The other consequence of the pandemic was economic. So it led to economic turmoil. India experienced a great economic shock. As you can see, India rebounded, but the initial economic shock was much more severe than the world median. So in this paper, what we're trying to do is we're saying that the combination of economic crisis and school closures led households in India to change their educational expenditure and also their schooling decisions. This brings me to our research questions. So our research questions are, what is the impact of COVID-19 related school reopening on household education expenditure in India? What's the impact of COVID-19 related school reopening on school choice in India? So for example, school choice in the terms of moving from private to public schools, from public to private schools, or dropping out of schooling altogether. And finally, what was the impact on time spent on learning? To answer these questions, we leverage 2 sources of data. So the first source is data from the Center for Monitoring the Indian economy's consumer household pyramid data, or henceforth CMIE. CMIE is a high-frequency panel data of household consumption. So we use data from 2014 to 2022. These data are collected quarterly, and every quarter it has detailed information about consumption, specifically on education expenditure for different education categories. Something else which is relevant to this paper is that CMIE has data for time spent on learning and just generally time use data. The second source of data we use is data on school closing and reopening by state between February 2020, so just at the beginning of the pandemic, to August 2022. These data are manually coded through media reports and government circulars. So just kind of talking a little bit more about the data and giving you a few more specifics which will inform our results. So the CMI data contains data, as I said, on children's time spent on learning and household expenditure on school fees. But the data doesn't explicitly provide information on whether children are in public or private schools. So to kind of identify that information, we use data on school fee and time spent on learning. So if school fee and time spent on learning are both positive, then we code that as child attending private school. If school fee is 0, but the time spent on learning is positive, we code that as child attending a public school. And if both are 0, we code that as not attending school. The other important aspect of our data is the school reopening data. Again, as I mentioned, these are hand-coded data using media reports and government circulars. So the way we code it is by state, quarter, grade level. So first, we divide the data into 3 grade levels. So primary, 1 to 5, upper primary, 6 to 8, and secondary, 9 to 12. Then, of course, we kind of divide the year into 4 quarters, as one does. So the way we code it as is school is open on if school is open on any day for any grade of a grade level in a quarter in a particular state, we code that as open for that state, quarter, grade level and closed otherwise. That's quite a mouthful. So I'll try to illustrate this with an example. So for example, in the Indian state of Delhi, if say schools were open for grades 1 to 5 in the months of January to March 2021, then we would code that as open for Delhi for that quarter for the primary grade level. So that's essentially how we did the coding for school reopening data. So before I go to our empirical strategy and our causal results, I want to show some descriptive results. So this is a chart of school attendance by private schooling, government schooling, and out of school students, right? So this is CMI data from 2014 to 2022. So from 2014 to 2019, we roughly see enrollment in government schools decreasing and enrollments in private schools increasing. So in 2019, it's around, the enrollment in private school is around 40%, right? But around the pandemic, we see the kind of trends go in opposite directions. So the enrollment in private school dips and the enrollment in government school increases. So we kind of see a switch here. We also see a slight increase in the number of, or in the proportion of out of school children. This is our other descriptive result, is just a sharp increase in out-of-pocket expenditure on education, right? So which we would expect given the economic shock. So educational expenditure dropped across the board. The blue line is the total education expenditure. So like you can see from 2019 to 20, we see a sharp decline. And the other lines are education expenditure categories. So even in those categories, we see a sharp decline. All right, so we've arrived at the mathy part of our presentation. So we're trying to estimate the change in education expenditure between households that send their children to different grades. And we leverage this, and we leverage the variation in state level school reopening and the variation in grade level differences in school reopening across states. We use child, grade, state level, and quarter fixed effects to compare observations within these levels. We also capture other outcomes, which is not shown in the specification here. So specifically, we capture 4 outcomes related to school choice. So the first outcome we capture is switch from public to private schools, from private to public schools, from private school to dropout, and from public school to dropout. So this is the first set of event study results. So we plot our results in an event study design. And before I kind of talk about the results, I'll briefly talk about the event study plot. So the first 3 quarters are the kind of negative quarters are, the first quarter is the pre-pandemic quarter, and the 2 other quarters are when there was a national lockdown in India. So schools weren't open across the board, across states, regardless of grade level. So that's the first 3 quarters, the kind of pre-trend, so to speak. Then in September 2020, schools opened in India. So everything is relative to the quarter before which the schools reopened in India. So all kind of point estimates are relative to that. So this is the event study plot for private to government school switching. And here we find directly after schools reopened, we see a 2.5% increase in private to government school switch directly after the quarter. And then in the next quarter, we see like a 1% shift. And then after 3 quarters, we see a decline and it becomes 0. Then this is the event study plot for private to school dropout switching. So students, children who were in private schools, did school reopening cause them to drop out, right? So here we see a very small positive and significant effect of school reopening on private school to dropout. Then our next plot is public to dropout school switching. So did school reopenings in India cause students from students who are in public schools to drop out of schooling altogether? Here, though, there is a downward sloping line, but we see no effect because the confidence intervals are large, and we can't precisely estimate an effect. Again, this is more on the expenditure side. So we kind of check if school reopening caused a change in expenditure on private tutoring. Here too, we find no effect. Time spent on learning, did that change as a result of school reopening? We see it decreasing, but there is no effect. And I think the time spent on learning as a result, like the decrease in time spent of learning as a result of school reopening, might be because students were potentially like studying or engaging in studying remotely before schools reopened. Or the other possibility is that students dropped out of school altogether. So talking about some of the potential like mechanisms, like what happened, why do we see these kind of shifts in expenditure, and especially some preliminary results on the side of switching from private schooling to public schooling or dropping out of school altogether. So one mechanism could be substitution. So basically households substitute from formal schooling to private tutoring. However, we don't see that in the data. We don't see like an increase in private tuition or private tutoring expenditure. The other thing could be like households are waiting. Households are waiting until formal schools reopen. So they've artificially kind of stopped spending on education for a period of time, and they're waiting for schools to reopen, at least in our period, for them to start spending on education again. The third possibility, which seems more plausible, is just an economic crisis where households have permanently decreased their expenditure on education. Because of COVID, there has been financial turmoil, and that might have kind of forced households to shift resource allocation towards other aspects of consumption and moved it away from schooling. And then on the private schooling side, so why do we see these shifts in private schooling and what mechanisms might explain them? So one thing could be that on the demand side, once schools reopened, parents simply couldn't afford sending their kids to private schools. So kids dropped out of schools altogether. That could be one mechanism. On the supply side, when the schools reopened, potentially because of the economic crisis, a lot of private schools in India had to close down. And then the school and the students who were in those schools had to either move to public schools or had to get out of school altogether. So just again, summarizing some of our tentative conclusions. So we see an initial small switch from private schools to government schools and government dropouts, school dropouts. We see no increase in expenditure on tuition. So this kind of suggests that financial crisis hit households and they responded by cutting back educational expenditure altogether. And we see a non-significant decrease in time spent on learning. Given this is kind of preliminary, this is a very preliminary analysis. So we're kind of thinking of next steps in terms of our analysis. So first, we're thinking of running analysis with other specifications of school reopening. So for instance, using coding data as the number of weeks schools were open in a quarter rather than a simple binary of 1-0, right? And also using more recent CMI data, because currently we use CMI data till August 2022, and we might want to figure out the long run effects of school reopening. So we might want to see data from 2023 and also data from before. But anyway, thanks a lot for listening to me. And this is like a preliminary stage project, so we will appreciate all kinds of feedback. Thank you.
Yes, thank you for this very interesting first presentation. I'm happy to follow up. My name is Andreas. I'm a postdoc at the Federal Institute for Population Research, or BIB. And I'm presenting on young women returning to school in Sub-Saharan Africa during COVID-19. Just something before I start. I was asked a lot by some Americans attending this conference, we have a Federal Institute for Population Research? And the answer is no, sorry. We are a German institute. We were founded 50 years ago to analyze demographic change in Germany. Since then, we have brought out to global population studies. I'm in the research group, Global and Regional Population Dynamics. We are a mixed team of demographers, economists, I'm an economist, and statisticians. We do research on global population trends. And if you work at UN, we also represent Germany, the UN Commission on Population and Development. So sorry, not an American institution, but we are around doing population research on developing countries. So the motivation for this paper is, as we all know, the COVID-19 lockdowns in 2020 led to nearly global school closures for several weeks at least. And after spring 2020, we saw a lot of heterogeneity in the duration, continued stringency, and recurrence also of school closures. So the questions are, of course, how have the school populations been affected? How have they adjusted? How have they responded to these lockdowns? And Sub-Saharan Africa is a particular case, of course, because there's generally high uncertainty about the return to school. For example, there could be binding economic constraints on students. There's particular vulnerability of female students. And some of these concerns have already been raised by some papers published early or during the pandemic. And so in this paper, I try a bit to study the return to school of young women in 6 sub-Saharan African countries, where I can differentiate between the prolonged closures, the reopening of school, and the actual return behavior. I can also analyze female fertility and labor supply, conditional on whether the school has reopened or not, and whether women have returned or not. And thereby I try to contribute to a growing literature on the gendered educational impacts of COVID-19. The data stems from the performance monitoring for action surveys, which have been collected in Burkina Faso, Cote d'Ivoire, the Democratic Republic of Congo, Kenya, Niger, and Uganda. There's broad subnational coverage, except in the DRC, where only like the two most western regions are covered. It includes, for this particular questions related to schooling, women aged 15 to 25, a total of 8,311 observations. Actually, PMA is a longitudinal survey that started right before COVID, but I'm using only the phase 2, which was collected at different timings within the pandemic, giving me some variation that I will show you in a minute. So it asked about, in this phase 2, about school attendance at the outbreak of COVID and the reopening of the schools and the return behavior, and also contextual information on fertility and labor supply. For labor supply, I can distinguish basically two outcomes: whether women have done any independent and paid work recently, which I argue is kind of an indicator for more skilled employment, or whether they've just done work aside from their own housework, which was defined or surveyed as basically work close to the household farm, for example, so rather low-skilled work. So, I hope you can see that. So this gray shaded area is the survey collection time, and these are is a school closure index for Burkina Faso. So there was a hard lockdown requiring closures at all levels in March 2020. But then was phased out, very brief, raising to a level of recommending closures only, but by the time of the survey collection, the big lockdown was already beyond. That's similar in Cote d'Ivoire. Actually, there was a small rebound around the Omicron time, but the survey was collected right before that, when the restrictions had been phased out. Similar, Niger, survey was collected actually in early 2022. Long after the last restrictions had been there. The DRC is a bit of a mixed bag because they were in the process of phasing out the restrictions by the end of 2020. And there was a brief rebound of the lockdowns, but basically all this is overlapping with the survey collection. And then there are the two basically prolonged closure countries, which is Kenya, which by the end of 2020 was still recommending or was still requiring school closures at some levels when the survey was collected here. And of course, the case we've heard before from Uganda, where closures were required at all levels far into 2021 when the survey was collected. So if I just basically pool the information from all countries, I adjust for country fixed effects, and I plot the school attendance before COVID-19 across the age of the female respondents, and then what is said during COVID-19. So basically, have you returned to school? I see a drop in female school attendance at the youngest ages of 15 by something like 20 percentage points, and by at least 15 percentage points even at the higher levels, who were, of course, attending secondary, tertiary education by this time, by the age. So basically a quite large drop in school attendance all across the age range. When I do this country by country, we see a fairly large rebound of female school attendance in Burkina Faso, Cote d'Ivoire, and the DRC, and in Niger, at a low level, of course. But we see very low rebound in Kenya and Uganda, of course, the two prolonged lockdown countries. These are the rates of school reopening. So between 70 and 80% of women in the sample actually said the schools have reopened. And again, 70 to 80% have then also returned to their schools when they have reopened. Also, this is a surprisingly stable pattern across the whole age that I see. When I do this country by country again, in the 4 countries that reopened kind of quickly, large rate of reopening and high rate of return. Kenya actually has a fairly high reopening rate, but a low rate of return of only 40%. Uganda is has a low rate of reopening, but actually to the few schools that have reopened, there's a high rate of returning to them. So moving to the regression analysis, what I can do, so I regress a dummy if a woman is currently pregnant on the information about the school reopening and return. So the baseline comparison group are women who have already been out of school before the pandemic. Then the first group are women who say their schools are still closed. And then I get into the group, they say that the schools have reopened, but they have not returned, meaning they have dropped out of school. And then the last group are women whose schools have reopened and who have returned. And I control for age and country fixed effects, control for household wealth, the school level, and in the second and fourth column, also for births that have occurred before the pandemic. So in terms of pregnancies, we don't see much. Could of course be the reason that the pregnancy rate is quite low, just 6%. So it's difficult to find significant differences here. But we see a lot more in terms of births that have occurred since COVID-19. So that's also a dummy, whether a woman has had any births. So we see compared to the baseline of women who have already been out of school, the women who are still under lockdown have a significantly lower probability of having given birth. So we can see basically some protection against fertility still for them. But the women whose schools have reopened but who have dropped out actually have a 4 percentage point higher birth rate since COVID-19 than the women who had already been out of school before. And the largest protection from fertility are of course enjoying the women who have returned to school because their birth rate has been significantly lower by 4.3 percentage points, which are all large differences compared to the baseline of nearly 13%, the baseline birth rate among the out-of-school women. Here I differentiate this by age. The good news here is there's not much going on in terms of teenage. So the darker plots are women aged 15 to 19. There the differences in the birth rate since COVID-19 are actually quite small. When this is opening up at age 20 to 25, then of course the out-of-school women have a higher birth rate, but the women who have dropped out of school during COVID-19, their birth rate then also jumps up basically to the same level. I can do the same for labor supply using the more skilled independent paid work outcome. And here we see the women under lockdown have a 3 percentage points lower probability of having done this more skilled work, which makes sense. They're still under lockdown. They're still waiting for the schools to reopen. But then what is concerning is the women who have dropped out also have a significantly lower probability of having done this skilled work. Meaning, although they have dropped out, this doesn't look like they've been well integrated into the labor market already. And which is not surprising then, the women who have returned to school, they're of course less likely to have provided labor as well. But actually there's no difference between the dropouts and the ones who have returned to school. When I look at the less skilled work close to the household, the women under lockdown, less likely to have provided this work. But what is also concerning, the women who have dropped out are just as likely to have performed this kind of simple work as the women who had already been out of school before. So there we see a complete assimilation basically in this low skill segment of labor supply. And here, of course, the women who have returned to school are the most protected against having supplied this low skilled labor. So in context, generally there's a high share of female students returning after the lockdowns, which is in line with some country by country findings I've cited before. The prolonged lockdown in Kenya is consistent with some evidence on learning loss in Kenya from other studies. I have a small paper and some colleagues from the Johns Hopkins have a paper on pregnancies and unintended pregnancies during COVID-19, using also PMA data where we didn't find any differences in pregnancies, consistent with here, but we didn't look at birth. So at birth, actually, there's more happening. And the results basically could indicate potential labor market scarring effects. So basically, these women were pushed out of education during the pandemic, which was also a very difficult labor market, meaning they had great difficulty integrating into the labor market and were punished by this by only finding these low-skilled jobs, which is in line with results presented in a recent very nice World Bank report on human capital losses during the pandemic by Shadi and Silva, who were the editors. There were many contributors. Limitations of what I'm doing. So everything here is self-reported, could of course be some biases or mistakes. It was not asked about online instruction, but I think we know online instruction probably played only a limited role in Sub-Saharan Africa. I don't have information on men of the same age and potential gender gaps. Of course, they are also important. I have no information on learning, only on attendance. So basically, learning is where you come in. And what I'm really comparing is I'm most comparing women between countries due to the national character of the lockdown policy. So for example, I'm comparing women in Uganda who are still under lockdown to women in Burkina Faso where the lockdown has already been lifted. So what I want to say with this, I'm not giving this a causal difference in difference interpretation because I don't think, I mean, some people might argue this, but I think this basically country comparison doesn't make or isn't telling so much in a causal way. Although I have pre-pandemic controls, at least for fertility. So short lockdowns, basically the message in the 4 countries had only marginal impact on female school attendance, but the prolonged lockdowns, they did still a lot in terms of depressing female school attendance way into 21 and 22. Interestingly, the rates of reopening and return have been stable across age, which maybe is a concern because we would think the highest priority should be bringing the women aged 15, 16 back into school. So that's maybe concerning. We didn't see higher rates of return there. The fertility of non-returning women since COVID-19 is higher than the fertility of women who had left school earlier, even after controlling for pre-COVID birth, which of course could indicate potential selection of women with stronger fertility preference or high vulnerability to into non-return to school during COVID. And there's indication of labor market scarring among the dropouts. So basically, this is a big picture paper spanning several countries to now connect maybe back to the micro evidence that you are mostly working with. What do we know about incentivizing return to school? We will see about this in Carolina's presentation. There's also a paper by Malutra et al. It could be potential for on-the-job trainings for school dropouts when they're in the labor market later. Could also be an opportunity for expanding remote learning opportunities to higher ages, as we saw yesterday in the presentation of the paper by Norm and co-authors. And there could be a role for increased support for family planning after the first child, basically, if this has occurred during the pandemic. Thank you very much.
Thanks so much, Andreas. And now Carolina to close us out.
Thank you. Hi, everyone. While they're loading the presentation, my name is Carolina Better. I'm an Associate Managing Director at Ideas 42, and I lead our global education portfolio or sub-focus area. And today I'm going to be presenting, thanks for the mention, Andreas, by the way. I'm going to be presenting about a project that we conducted in the summer of 2021, where we designed behavioral messages to encourage caregivers to send their children, with a particular focus on their daughters, back to school once they reopened in Uganda. I know we've heard a lot about Uganda. And before I get started, I guess as I've met people in this conference and I say I work for Ideas 42, I get one of 2 reactions, either ideas what, or, oh, cool, Ideas 42. So if you're on the first group, we are a nonprofit organization that uses applied behavioral science to find solutions to various social problems around the world. It started more than a decade ago as a small lab in Harvard University by some professors that basically wanted to bridge the gap between theory and practice. And so that's kind of the goal of what we do. I'm not an academic. We really bring in our projects the expertise on behavioral science, and we rely very heavily on our partners, implementing partners on the ground. And so for this project, we partnered with USA Uganda, who we've also heard about in this conference. But for those of you who don't know them, they're a nonprofit organization based in Uganda, and they essentially run household learning assessments every 2-3 years to measure numeracy, literacy skills of children ages 4 to 16 years old. and this work was funded by Kidney Giving. So some background, I'm going to go through this quickly to not be repetitive, but kind of to set the stage. Before the COVID-19 pandemic, about 260 million children, adolescents, and youth globally were out of school. This is about 1/6 of the total global population for this age group. Despite all the work that people in the room, outside the room have done to kind of close the gender gap in education, there's still a gap. And so in Sub-Saharan Africa, for example, for every 100 boys that are out of school, there were 123 girls out of school in 2019. In 2021, when we did this work, it was actually estimated that 11 million girls would not return to schools, with adolescent girls being at particular risk in low and middle income countries. And then as we've heard over and over, Uganda saw the longest pandemic prompted shutdown in the world, which lasted 22 months. So what was our objective and why did we partner for this work? 2021 was actually a very unique year for USO Uganda in that it was the first year that they were going to conduct this learning assessment while schools were closed. And so we saw this as the perfect opportunity to actually design messages to encourage caregivers to send their kids, with a special focus on daughters, back to school, because we were going to have their attention in the first place. Girls were out of school, kids were out of school, and there was going to be someone that was going to be talking to them. So they had the opportunity to do that. And so how we did this, we followed our framework. This is kind of the framework that we use for most, if not all, of our projects, where we start by defining the behavioral problem or challenge that we want to focus on. In this case, it was how to encourage caregivers to send their kids and daughters back to school. We then diagnose the features of the context or the environment that might be causing or exacerbating this behavioral challenge, typically through qualitative research methods. We then design an intervention. So we design potential solutions that directly address the behavioral barriers that were identified during diagnosis. We then test them, ideally through RCTs. Sometimes that's not possible. And then we aim to scale any proven solutions. So again, the behavioral challenge, encourage caregivers to send their children, particularly their daughters, back to school. And what were some of the key behavioral barriers that we identified? I'll start by saying that we didn't have a lot of time to conduct diagnosis, because when this project started, when we received the funding, there wasn't a long period of time between that point in time and when the assessments were going to happen. And so we had to kind of do a quick diagnosis. And so we ended up interviewing USO Uganda staff and volunteers and some of their partners. And some of the key behavioral barriers that came out of this, and these are hypotheses, were one, social norms. So this idea that we as humans will act in the way that we see others in our community, or we think that others in our community are acting, whether they do it or not. It's the way that we think that they're acting. So in this case, you know, caregivers may believe that it's not common to send girls to school, and so they choose not to do that. And this could have been exacerbated during COVID because of some of the things that Andreas was just presenting, increased marriage, increased pregnancy rates among girls during COVID-19 could, you know, prevent them from going back to school. Another thing that came out of these conversations was that present bias. So this idea that we'll prioritize the present and sometimes at the expense of our future. And so in this case, what that meant was, you know, caregivers may focus on the short-term benefits of having girls help out at home or contribute to the household income. And this is particularly important during COVID because the kids were already out of school. So this idea of, you know, keeping them in the house versus sending them back is already more challenging. As well as, you know, people were facing economic challenges, as we heard as well in the previous presentations. And so, it's very salient what the benefits of keeping the kids at home are versus the long-term benefits of sending them to school. And so we designed 2 interventions. Both of them have the same 2 components, which I'll get into in a second, but I will caveat by saying that another constraint that we had was that these learning assessments are already taking a long period of time. Enumerators and volunteers are already spending a lot of time speaking to caregivers in the household. And so they really wanted the intervention to be very simple, very quick, easy to implement, and ideally easy to scale. And so what we came up with was interventions that follow these 2 components. First, it was a message that the enumerator would read at the end of the survey, and that was coupled with leave behind material. And so the first intervention was targeting this idea of social norms. And so the message that was designed read like this. In Uganda, more than 8 out of 10 parents are sending their young children to school, and almost half of all students are girls. Each year, more than 100,000 students graduate from secondary school or start their tertiary education. Don't let your daughters and sons be left behind. And then the enumerators handed this certificate of planned completion to the household head of household. And they handed 1 certificate for each of the kids in their household. So not just their daughters, not just, a specific age group, where they had to complete the name of their child and certify that they were going to send them to school, their signature, and the date. And branding from US, so Uganda, to increase credibility. The second intervention addressed the present bias hypothesis. And so the message read, children who complete their education are empowered to support their families. This is especially true for girls. Girls who complete their secondary education make twice as much money on average, with those completing their tertiary education earning even more. Overall, completing education is much more profitable than dropping out of school for reasons such as taking a short-term job or getting married early. So really highlighting the financial benefits of completing an education. And this was coupled with what we called an education commitment, which basically highlighted, again, the benefits of sending their kids to school. And it had what we call an enhanced active choice, which is basically just showing, the 2 choices and the benefits and cons of whichever choice they select. So yes, I'm going to send my kids to school and these are the benefits, or no, I choose not to send them, and these are kind of the implications of not doing so. And again, signing and dating it. And I should mention, we designed these in close collaboration with USO Uganda. And so for the experimental design, we ran on RC team. And so basically the household assessments were the learning assessments were conducting in the summer of 2021. And USO visited 5,000 households that were randomly assigned into 3 groups, either treatment 1 that received the social norms intervention, and 10 districts belonged to treatment 1. 10 districts were assigned to treatment 2, which received the present bias related intervention, and 9 districts were assigned to the control group. In January 2022, schools reopened, and USO collected data at the school level. I'll get to that in a second, by selecting a sample of 5 districts per group that contain about 15 schools per district. And so, as you might be thinking already, this is kind of one of the key limitations of this project, which is that treatment was delivered at the household level, but data was then collected at the school level. And so we lost a big sample in doing that, but unfortunately, that's kind of the resources that we had, and it was the second best option that we were dealing with. And so what we found, and the results that you see here, are comparing percent change in enrollment from March 2020, which is when schools closed, and then comparing it to re-enrollment rates in the term between January 2022 through May 2022, which is the first term after schools reopened. And so what we found was that schools in districts belonging to the control group increased their total enrollment, so for both boys and girls, by 2.5%, and schools in districts belonging to the treatment group increased their total enrollment by 9.5%, which is about 2.8 times more than the schools in the control group. And we see kind of similar results for when we look at the data for girls only. When we compared the two treatment arms and kind of tried to see whether one was more effective than the other, we found no difference. No difference when we looked at girls only either. And unfortunately, these results are not statistically significant, which was super disappointing. But why am I sharing them today then? Good question. So, perfect. So one thing I want to highlight is how the interventions were so low cost. I didn't mention this, but they cost less than 20 cents per child. It was mainly just printing that material, training the enumerators to deliver the message. They were extremely easy to implement. Enumerators were already speaking to caregivers, so they just needed to add that to their talking points. And when we look at effect sizes are actually pretty big, and the sample size is pretty small. So we feel that these are suggestive results that behaviorally designed interventions can be effective at impacting caregiver behavior, especially when there's already a channel that can reach so many people. And so kind of just want to encourage you guys, and if anybody wants to test this out with us with a larger sample, we're in, let me know. But behavioral messages delivered through national assessments have large impact potential at scale. And, you know, in this case, we focused on encouraging caregivers to send their kids back to school, but we could use any potential message. It could be about encouraging caregivers to read with their kids more often, or to engage in online learning platforms with their children. So kind of the opportunities are out there, and these can be very, very simple, low-cost messages. This is my email in case anybody is interested in collaborating. Thank you.
So any questions on the paper about the 6 countries in Africa? Oh, yes, Megan, please.
This might be a little bit more of a clarifying question, but
Is that better? Okay, great. So one question about the conclusion that you arrived to at when we saw the fertility drop, or sorry, the fertility rates were lower for young women who both dropped out, or sorry, who didn't return to school. Is that right?
No, they were higher.
Fertility rates were higher for young women who didn't return to school. And one of the hypotheses at the end is that there could be some like reverse causality there. And I just wanted to hear a little bit more about like how we should think about that related to like the differences between those schools and the comparison group, because I was just like a little confused about that. It could be a question for the future, but I just was thinking about if the comparison group is places where thinking about like what is the comparison group and how that coefficient is different. So is it that in places where there were longer closures, young women were more likely to could have been more likely to get pregnant, and then therefore they couldn't return to school? Or am I not thinking about that in the correct way?
Okay, so
we'll take a round and then we'll come. Any other questions? Right, then I have one to add,
Sure.
Which is actually a question for both of you, for both of the descriptive papers. I was wondering about characteristics that might be able to differentiate between the returners and the non-returners. You both were drawing on larger surveys, which is something I think is interesting about all 3 of these papers, actually. And you're both drawing on larger surveys, and you wouldn't be able to say anything causal necessarily, but might there be any interesting coefficients in those fixed effects buckets that we could look to for identifying the at-risk students? So we'll give it to Andreas, and then Ashutosh, you can also respond to that one.
Yes, thank you. There was a comparison group where women who had left school even before COVID. So they, of course, advanced already on their fertility trajectory earlier than the women who stayed at least in school until COVID. And I tried to control for this with a pre-COVID fertility control. And then I basically see this overshooting of the women who dropped out during COVID in terms of their fertility over this baseline comparison group. There could, of course, be that a lot of first birth happened among this group of women. And I agree the causality there, it could be the direction of what happened. Basically, the time sequence is not clear and I only have one wave of data per country. So I cannot basically take this apart if this answers your questions.
Yes, it does. Just basically like we can't reject the fact that it could have been reversed.
Totally.
Okay.
Yeah. And to your question, yes, basically you can turn these regressions around. So you can use the return status as an outcome and regress it on individual household characteristics, which would also not be causal because there could be lots of unobservable selection going on. I agree, it could be interesting. The problem is you can not really present both things in the same paper. Basically, now I'm flipping around my regression. So I was using basically this group allocation of return, non-return. We can argue the school reopening basically was a policy decision. So at least this group allocation was determined exogenously. And then there was a self-selection of women into return, non-return. There's a different paper. I know Isa Scudis is on there. She's at the World Bank. It's a working paper by the World Bank, and they also do cross-country analysis of school return. And yeah, they basically run the reverse regressions, which characteristics are associated with the return. So you want to look into this, I think you will find it.
Yeah, I can only speculate, which is not a great habit as an academic, but I suppose based on what we're saying, that educational expenditure has reduced. One kind of heterogeneity would be in household incomes. So SES, lower income, higher income households. The other thing which Andreas' paper also kind of points out, there could be a gender story. So within households, if there are multiple children, maybe boys might be prioritized over girls. But again, all speculation, we'll have to kind of do some heterogeneity analysis and see if those patterns actually exist.
So let's open it up now for paper questions about any three of the papers. Go to Kate.
Hi, my question is for Ashutosh. I was wondering if you could just speak to what the broader implications are for the Indian school system of the shift from private to public schools. I could imagine, a narrative where this has been really hard for public schools to absorb more students. I could also see a potentially positive spin where this might kind of lead to greater investment in the public school system from families that have traditionally opted out. And then I can also, I'd be curious to hear if you've been seeing a lot of closures of private schools in a way that's kind of reducing supply of those that may also be affecting then parents' decisions.
Well, here in the second row or third row. No, right here, next to Menno. Sorry, Katie.
Also to Ashutosh, so just wondering during the pandemic time, if there is any way to figure out if, say, non-profits stepped in a lot during that particular time, which could have contributed to reduce expenses because of that. So, so maybe that's something more of a suggestion than a question on that.
Thanks. Third question. Oh, Menno. Abhijit, go for it, and then we'll come to Menno.
So my question is also for Ashutosh, and it's one of those annoying ones about, I would write the paper differently, but I'm just wondering if you have a sense of what the heterogeneity in just the descriptives looks like, both across the SES distribution and different states, because to some extent, everyone's forgotten that COVID happened, and discussions of, whether school closures were a good thing or a bad, that is not unfortunately, that's just not something that we're talking about anymore or are thinking about till the next pandemic. Whereas all of these other things are things that we will have to deal with in the next year, 2 years, about exactly who is in what type of schools and are they staying there? Because that has implications for, what populations are you serving? How has that changed? How has composition of classrooms and things like that changed? So that was just a suggestion for stuff that you can do with your data now that you have the code set up.
Menno, who is your question for?
That was also Ashutosh.
Okay, so why don't we hold on that one? I'm gonna ask the question for Carolina and then we'll do another round. So Carolina, for you, I was really interested in the sort of pictogram you shared of your process as an organization. And I was wondering, one thing I didn't see is like a refine step, like we get the results and then maybe we do something differently. So I was wondering if there was anything that you learned in this study that if you were doing it again, or maybe for the future collaborations that you're gonna get lots of emails about following this conference, things that you learned that you would do differently in the future.
Okay, so
Go ahead.
So I'll start with the first question. I hope I get this. But like you're kind of asking about the broader implications for the school systems, especially like private versus like public schooling in India. I mean, like I don't know about the broader systemic issues. Like I think, but one thing seems for certain that it's definitely been a net negative in terms of students dropping out of school. And if there are students moving from private schools to like government schools, obviously there must be some kind of a strain on like government schools. So I don't know if there is a positive spin to it. The positive spin could be that there might be a greater reliance on public schools and shifting away from like private schools, which was the trend we were seeing before 2019. But it's very hard to say if this is a net positive. And Sabrish, yeah, great point. We kind of look into some heterogeneity regarding like non-state actors being involved in states in terms of helping the school system and kind of helping with school closures. To Abhijit's point, yeah, I agree with you. I think it would be interesting to look at a lot of heterogeneity across states. Now we have the code, we can look at like across states, the amount of a school closure like across states and how compositions of students in these different states has changed. That would be interesting to see, and that's something we might want to do as next steps, which we would like to do.
Thanks for your question. So that framework that I presented is actually a simplified version of the framework. It typically has like all these arrows going back and forth because the idea is to continuously refine and iterate based on the findings on each subsequent phase. So like you go to diagnosis, you're going to find so much more information than you had during problem definition. Is that really the problem? Okay, let's go back and forth. What I would change, I mean, ideally, we would have a bigger sample so that we get significant results. That would be number one, if we were able to collect data at the individual level, or even be able to track the specific students that received the intervention and what happened with each individual. That would be ideally what I would want. If I could go back and redo it again, probably spend more time in diagnosis as well, so that we feel more comfortable with that those are the right behavioral barriers. I think they are accurate, but maybe we missed some other ones that we didn't address necessarily. And so just knowing that.
Menno, we'll start with you.
I just misunderstood, but could the shift towards public be just a definition question, that maybe because school closures, they stop paying for school and therefore you suddenly classify them as public?
So we'll do it around.
Okay.
Also, is it my turn?
Yes.
Ashutosh, what was the discussion, or was there any discussion by the government on strategies to to respond to these shifts? So subsidies, maybe subsidies, temporary subsidies for private schools, or some kind of strategy to absorb students quickly into the public sector. I asked this because in Peru, they had a very similar quick exodus of students from the private, and the government decided to absorb them. They used kind of a centralized mechanism to quickly absorb them, and they thought about the two options. So I was wondering, if was there any discussion about this, or was it just something that happened, and what did this cause any problems in the public sector, overcrowding, or how did they absorb these students?
Great. And then I think we'll go to Lant.
I was just curious, like, how do you, if you do two treatment arms, they have the same effect. Why isn't it just a Hawthorne effect? I mean, it seems impossible to say this was a behavioral thing versus it was just a Hawthorne effect. Somebody saying anything would have had exactly the same impact. I just don't understand. I mean, this is sort of generic about these behavioral interventions. It's like they never seem to be tested against a real hypothesis.
So we're gonna go to Ashutosh.
Yeah, I can respond. No, you're right. Actually, this is something we might want to look at because we can't identify in the data in the survey whether the students went to private schools or like public schools, and the only way we are able to identify is that if they don't pay fees. But if private schools for a particular period of time stop fees, they might be classified as like public schools. And this might have happened in certain states. So this is something that we might want to look at and see if there is state level variation like based on that. So you're correct on that point. And it links well to your point about like how government was involved. I don't have the data about particular states, but certain states in India did ask private schools to temporarily stop charging fees. I don't know how long that period extended, but given that students were trying to go back to school and a lot of families weren't able to pay school fees, at least not stop paying fees. I don't know about stop, but at least a reduced amount of fees or like delayed fees or some kind of a structure for families to allow families to be able to cope with the economic crisis caused by the pandemic. The other mechanism that we are trying to look at and dig into deeper is that certain schools in certain government schools in certain states provided some kind of resources like free schools, free stationery, or something that might have made them more attractive compared to private schools. So that could have explained some of this switch from maybe private to like public schools. But yeah, both great questions.
That's a great question, and it could be Hawthorne effect. I think the reason why I don't think it is because it was different from the control group who also received some sort of mention about whether the kids were going back to school or not as part of the assessment. It wasn't a behavioral intervention telling them, hey, these are the benefits, or hey, these are the economic benefits, or is what your community is doing. But they did have the mention of, are you going to send your kids back to school? Are you planning on doing so? But again, it's a sample issue. So like, I would love to be, I think the reason why there isn't a significant difference in the type of intervention either is because of the low sample as well. But I would love to have an answer of one was better than the other.
So yeah, we'll start in the back and then come to the front. Oh, go ahead.
Okay, I have a question for Carolina. So you see some effects, even though they're not significant due to the sample. Have you had any talks with people from the government or practitioners about implementing this, because it was also really cost effective? So maybe like tweaking something could also like be worth implementing at a bigger scale.
So I was just wondering, the results that we spoke about, they seem kind of obvious from a perspective of if you just generally think about it. And to some of those points of, I honestly don't think there was a large sort of a move where private schools were asked to stop their fees, and even if they did, they didn't actually do it. It could just have been as simple an explanation as government schools have no fees. So if there are no schools that are open, why should parents send their children to private schools? There is no return on investment on it. So just to enroll them into public schools could be as simple as that. My second point was there anything that you found a little surprising or confounding in any of your results, or was this more from a methodological perspective that this is the kind of analysis that could be done on an ongoing basis, which could be helpful? And the third thing is, did you look at UDI's data in conjunction with the CMIE data? Because some of the problems that you're talking about could be resolved. There you have actual enrollment figures, and government tends to report it quite stringently, even during COVID. So that could give you maybe more accurate descriptive of what is the government enrollment on any given year.
Including the other data.
A third one for this round? No, okay. Let's start with Carolina.
Okay. Yes, that's a great point. And our partner, so at USA Uganda, they're planning on incorporating at least one of the two messages in future assessments because it was so low cost and potentially effective TBD.
Yeah, so to answer your questions, like I think the trends made sense, but I think what was surprising was how sharp they were. I think that was something that was surprising. Great points about, UDI's ASER like data. We haven't looked into that. One issue could be like matching them through to like households, but that could give us some like aggregate data that we can use in our like model, which helps us understand variation across states.
I think we have time for one more round if there are any further questions or comments. No, everyone's tired. Ready for the weekend. All right. Well, then I will conclude by looking at my notes where I wrote down what I want to say to conclude and say that I think that these takeaways leave me with a mix of optimism and pessimism. On the one hand, the majority of children did go back to school, the vast majority in many cases. And on the other hand, in some places, particularly where the closures were longer, there were some long-lasting effects. And of course, it seems quite obvious to be concerned that the children who didn't return to school would be the most vulnerable in other ways. And now they have access to one less service and one less source of support. And again, just as I started, this makes me look ahead and think, what can we learn about this for future disasters, which is part of my, my question about the heterogeneity of the effects on different types of children and households. And I'm left with sort of three questions of what I'd like to see more of from this in the future. The first is, for the systems where the closures were longer and we know that the return outcomes were poorer, what can we do to work with our colleagues in the humanitarian space to make sure that reopening schools or some kind of reconnection of children to schools sooner on in the recovery process is a priority if we know that the length of the closure is something that determines the likelihood of return. For the paper from India, it makes me think about, systems where we know the private sector is a large provider of education. What kinds of support are needed to those schools and to the families that are sending their children to those schools, to make sure that return in the private sector is also prioritized and as a bridge to make sure that we don't lose those children. And then, this speaks to the labor market points that Andreas was making, for the children, both boys and girls who aren't returning to school, if that's not an option, what kinds of additional support do we need to try to make sure that the consequences in the long run for them are lessened if getting them back to school isn't going to be an option for their family. So those are the three thoughts I was left with. And it's just been such a pleasure to get to spend this time with all of you and to be here at the conference. I'm really excited to see what comes next in the conference next year and with the What Works Hub, and to see what this great community continues to learn and do to make sure that every child gets the education that they deserve. So thanks so much, everyone.
part of RISE, I think it was a very successful endeavor at producing research. And as we discussed yesterday, the question now is to translate research into action, which is an incredibly more difficult problem to cope with and to address. Second, I would like to say, for those of you who haven't been involved in RISE, I would encourage you to go look, because RISE really did attempt to do a whole array of approaches and researches and other kinds of things. So there was a fair share of RCTs done within RISE, but he also did a 12-country politics of education and learning within 12-country historical case studies. We did qualitative research in a whole variety of countries, both within the country research teams and dedicated separately by Masuda Mano, who looked at qualitative components and how parents interacted with schools, and each country was encouraged to think not just the implications of their own research, but to think deeper. So countries did evaluations of their teacher training programs, but then did this question of, and this follows up, for instance, with Paul Glevy's research in Nepal. If you have found that in this period of history, countries are still engaging in ineffective teacher training, the real question is how and why are they still doing that, right? How has it come to be that countries are still doing ineffective teacher training 50 years into the expansion of mass education? And so I do think, I just want to convey that out of RISE came some really excellent quantitative research, but Jonathan London's work on the politics of Vietnam and how Vietnam came to be a Vietnam, and Yamini Iyer's work, which was mentioned, on detailed, engaged. They literally had somebody in the schools implementing this program every day for a year, seeing what actually happened in the school in response to what was being said. So we do have a rich variety of research, and I encourage you all to look at that. And then I'm going to thank Claire, and then Claire is going to thank everyone else. So we have a gift for Claire. So why don't you come down? One of the beauties of being the research director of RISE is I did very little other than give a few speeches, because this conference has been arranged by Claire for...
Well, my son's 8, right? And RISE started when he was 8. He was born, so
it has been, the RISE conference has been one of the most enjoyable experiences I've had for 2 days every year, once a year for 8 years, because Claire has done a just terrific job of organizing the conference. So I'd like a round of applause for Claire for having organized it. A lot of cheese.
Those that don't live in Oxford, this is like gold. Go to the Gerications company and just cover the cheese. This is amazing. Then Liz going to say something. Why doesn't name come now? And then I'll get that.
I want some of that cheese.
Thank you.
In 8 years, yes, something to look forward to. No, I'll keep it really brief. I just want to say I think RISE has set the bar extremely high. It has been just tremendous to hear this conference and have been a witness to a bunch of the incredible work that RISE has done over the last 8 years. And I appreciate the challenge that I put forward, now to put it into action. We're hoping to do a bit of that and also put some rigor behind it and some science behind it. And just to say, it's one door is, I don't want to say closing, but it's sort of coming to a certain juncture, and then the other door is swinging. And we're cousins, we're siblings, we're hoping to carry so much of the incredible knowledge, know-how, people, coalitions that have been built through RISE forward. There's a quote that I really, really like, which I think we're going to need to think about as we enter this next chapter. I'm sure some people have heard about this, which is that people won't care how much you know until they know how much you care. And I think in this room is actually quite a mix of people, and people in RISE and people in the What Works Hub for Global Education who are building the know-how and also have the spirit and the care and the motivation to keep chipping away. So we won't solve the learning crisis in 6, and if FCADO extends to 8 years. We won't solve it in 8 years, but we will make some headway. And I really look forward to doing that with everyone here. Thank you.